Hey everybody, my name is Cameron and I have the privilege to be here today sitting with Dr. Connie Clancy and Dr. Brian Healy, and we are going to dive into the topic of trauma. All right. So, trauma has become something of there's just so much more awareness around it today than there used to be. And there's so many different ways to approach it. And these two have unique experiences that really offer themselves to be great experts to talk about this topic. So before I start asking them some questions and we dive into a little bit more, would love for just both of you to take a moment to introduce yourselves to the audience, and then we'll dive into some more depth. So, Dr. Clancy, if you don't mind, could you introduce yourself and share a little bit about your experience?
Sure. I'm Dr. Constance Clancy. I go by Connie, and I have 34 years experience as a psychotherapist and a life enhancement coach. I've practiced in Southwest Florida for many years, and I also practice in Colorado, and I work virtually all over, and I do a little bit of that. And I specialize with women's issues, trauma, healing from trauma, which we've had a lot of that in Southwest Florida the last year and a half. And I work a lot with adolescents and helping them just find out who they are.
Beautiful, beautiful, beautiful. All right. And Dr. Healy, could you share with us some of your experience and all that good stuff?
Sure. So I've been working here in Southwest Florida for 31 years now. I have Fort Myers acupuncture and massage. And as you know, our area was badly hit by Hurricane Ian. And there was a lot of trauma, both physically, mentally, emotionally. And as an acupuncture physician and yoga instructor and medical massage therapist, I've seen many people that are in various stages of physical recovery. Their homes are rebuilt or in the process of rebuilding, or they're temporary living but hoping to move to permanent housing, looking for work, putting their lives back together in the external form, but they're still dealing with the mental and emotional impact of what we all went through. So I use my skills in whatever way I can to help people move forwards.
Yeah, absolutely. I feel like that's a good transition into, inside of your practice, what are some of the symptoms and things like that that you see from people that are walking in the door, whether they realize it cognitively or not, just so that people can have a better awareness of what to recognize for themselves as it relates to trauma?
Sure. One of the biggest symptoms that we see is insomnia, anxiety, a degree of hypersensitivity or hyperreactivity, where they may have a vague sense of something not being right, and not necessarily knowing what it is. And then, something happens, a flat tire, which we have a lot of down here because of all the construction. It's a lot of nails in the road. And flat tire is a relatively minor thing, but when you have this underlying level of trauma and stress that's not being dealt with, that flat tire can be a big issue. So anxiety, depression. Then there's the physical symptoms. When we have stress, when we're uncomfortable mentally and emotionally, that always shows up somewhere in the body. Digestive issues are very common. I mentioned insomnia, anxiety. Some people can fall asleep, some people can't. Some people don't sleep through the night. And of course, something like sleep or not eating and having digestive issues, that affects every other aspect of your life. Then, of course, there's the physical things. Some people have sustained physical injuries. I haven't seen too many of them, but after the storm, so many of us were intensely in cleanup survival mode, and we pushed our bodies beyond normal limits. I'm speaking from personal experience on that. There's a saying that, I gave 110%, and then you can easily say, well, that's not possible or whatever. But I got a new understanding of that phrase, because what I had to do immediately following the storm, I was operating probably about 120%
Mm.
of my previous 100%. So,
Yeah.
And that was necessary at that time, but it can take its toll, you
Mhm.
know. I mean, when I finally reached a place where I could decompress a little bit, I woke up the next morning and I could hardly move. My body was so stiff and painful from that overdrive that I went into at the time. And I have a handful or two of patients that experience the same thing. They never had back problems before, but after having to empty their house in a hurry to get all the mold and everything out, they overdid it and now they have back pain. That back pain not only has a physical component to it,
Mhm.
but it also has the emotional component to it. So again, if we can help to deactivate that stress response that is related to the storm,
Mhm.
then that will help their backs heal. So
Right.
the emotional, mental stress is directly related to whatever the physical symptoms are.
Mhm.
I was speaking with a gentleman, a fellow business owner in the community, who, like me, sustained both significant damage to the home and the office. And he was relating to me that he's a very driven individual, very focused on work, but he related to me then when it starts raining heavily, he gets triggered.
Mm.
Now, he kind of pushes through it because he's got work to do and everything. But he shared with me that, yeah, he gets his work done, but he's not as effective or as efficient.
Mm.
Because again, that underlying stress response, you want to call it PTSD or whatever label you'd like to give it, that's operating and affecting his parasympathetic nervous system, depressing that, ramping his sympathetic nervous system on sort of an unconscious level. He's able to move past the shutdown or the complete dysfunction that can happen, and achieve a level of functionality, but it's not 100%.
Mm.
Last year, we had a brush with Hurricane Idalia. It didn't significantly affect us at all, and yet people in the neighborhood were wandering around like zombies. It was such an impact. Like myself, I didn't feel anxious or anything,
Mhm.
but boy, I just kept sleeping and sleeping as my coping mechanism.
Mhm.
So
And
those are the types of things that I'm saying.
Yeah. Beautiful.
And just to add to that, we
Please.
may not have what's called full-blown post-traumatic stress disorder, PTSD. However, trauma gets locked in the body.
Mm.
And what happens is we don't realize that we're storing that trauma. And one of the techniques that I think is so important is, and a certified clinician can do this, is EMDR, eye movement desensitization and reprocessing. That's a long term, but what it really does is through rapid eye movement, it desensitizes the trauma that's locked in the body. And
Wow.
then we link it up with a positive cognition once the trauma is desensitized. And when we link that up, we're actually rewiring the neural networks in the brain. And it is so effective. It started many years ago with working with war veterans. And then we found out with just people in general experiencing motor vehicle accidents or going through hurricanes that EMDR can be very effective. And so if you find that there are people you know or yourself is experiencing this kind of trauma and you're having these symptoms of, as Brian was saying, the fight or flight, the stress response, the not able to make decisions, not able to cope well. Maybe you don't even realize it, or you're doing some maladaptive coping, such as drinking too much alcohol or things that you normally wouldn't have done prior to the storm, that you're doing this. It might be a good idea to check with someone and find out about, would EMDR be for me? It's all natural and it really is effective. So that would be certainly a healthy coping technique too. And just asking yourself, well, what am I doing to take care of myself in a healthy way? Am I getting out and exercising every day, whether that means just taking a brisk walk or going to the gym, swimming, anything that is physically helping me to release that trauma as well. And where am I in terms of a sense of community? Am I helping others? We get so caught up in all the things we have to do with our own homes or condos, but what am I doing to pay it forward and help others and lending a helping hand? And I think those people who are involved in community and really reaching out and helping one another are much more apt to overcome their trauma.
Yeah.
But the other side of that is, I know many people, especially in the healthcare business, that's their way of avoiding their own stuff. By focusing on other people, oh, I'm fine. It's other people that need help. But then they get home at night and they're burnt out, they're crashed, and then their issues come up. So there is that. There's the moderation, and the healer needs to heal themselves.
Right, and finding that balance in your mind, your body, your emotions, and your spirit. What am I doing to get myself back into balance?
Awesome. Yeah, this conversation brings up something very recent for me, but it was really my, I don't want to say first because I don't need any more of them, but a big awareness of trauma. And to make a very long story short, it was my wife had a major unexpected surgery about 2 years ago, lots of blood loss, wasn't sure if she was going to make it through. And it happened on a Sunday night. And so for months after that, every Sunday I had this just dread feeling that would come over me. And we're actually approaching a 2-year mark. And I believe that some of that same PTSD is coming up for both of us. It's in weird physiological symptoms, some mental, some emotional. And so, what you guys both just shared, I can relate to, and I'm hoping the audience can as well, that it can be very underneath the surface, but so powerful and so overwhelming. And so I know that you talked a little bit about at least that one major coping strategy, Dr. Clancy, but what are some other coping strategies that you may be able to offer to everybody that's listening that may have, I don't know that I would consider this necessarily a life transition moment from like Hurricane Ian, but in a lot of ways it was a major life change moment. And what could you bring to the table there?
It is a major life change, and that's where having to make some important decisions really comes up. And some people really struggle with that. Like Brian just said, avoidance is the #1 coping technique. And we have to be really careful that we get past that avoidance and ask ourselves, what are some healthy coping techniques that I can be doing for myself or my family? Maybe we need to talk about it more, and what's going to serve us? What do we really, really want deep down inside? And that's where we really have to get out of our heads and dive down into our hearts and open up our hearts for self-love, self-compassion, and say, we've been through a lot. And maybe just either talk to a professional or assess, where am I really with my trauma and how am I coping with it? What kinds of tools do I have in my own toolbox to get through this? Because when we go through grief, we could go through denial. I can't believe that really even happened. And that shock, which I think everybody went through when the storm hit. And then we go through the anger. Here I've worked so hard to buy this home or fix it up and it's all in shambles now, or oh, my house is full of mold. And Brian, I know you went through all of that with home and office. And then we get depressed and we just get to that point where we're paralyzed and we're numb and we think, do I even want to rebuild? Do I even want to fix up my house, or do I just want to go someplace else? And we know that a lot of people in this area did end up moving away.
Right.
So depression comes in too, and there's no time frame of how long these symptoms last. They can be a few months to several years. And then we bargain, oh, if only I didn't buy that. Oh, if only I would have done this or done that. And then finally we come to an acceptance and we decide, I'm either going to move ahead and make a decision to do whatever my family and I agree on and what's in our highest good. And yes, we have to get into our thinking minds, but sometimes we do the monkey mind stuff and just get way too over the top with spinning, and where we don't take time to just sit down and breathe and get into that quiet space of some silence and meditation. We have the guru here, and really make those answers come from within instead of reaching out on the outside externally, trying to find the quick fix. And we as humans do that. And we want it now. We're a very instant gratification society, as we know. And we have to learn to practice patience. And that's very hard for us because we want it yesterday. So if we can learn to practice some patience and say, you know what, one day at a time, let's cultivate some present moment awareness and stay in the moment just for now, just for today, and not trying to reach too far out. Well, what if this, or when's this going to happen? And that's what brings on the anxiety. And so many of us are suffering now more than ever from anxiety.
Yeah. And that's, I mean, you're speaking right to me. A couple of things that you mentioned really rang for me. One of them is the timing issue. Okay, so for the last 16 months or so, I've been so focused on projects and my to-do list. You mentioned patience. Well, realistically, at the rate I'm going, it'll probably be another 2 years until everything's done at my home, like the outdoors, still down trees and erosion and all these other projects to finish. And my list would be, you know, if I put it all down, which I'm scared to do,
insurmountable.
The list would be far too long, and then I get overwhelmed, and then I get anxious, and all of that. So the patience part of this is important. And then as far as the timing of how when symptoms show up, I notice that my tendency towards being anxious or depressed seems to be a little bit stronger now that the major issues on my to-do list have come off. So it's not such a I need to do this right away mode that I'm in now. And now some more of the emotional things are coming up, and I also want to speak personally to the effectiveness of EMDR. Connie and I have known each other a long time. Probably we decided about 31 years now. We met out on Sanibel. She was coming to my yoga classes on the beach when I was teaching there, and I went through a divorce. And I saw Connie for a while, and we were doing EMDR to kind of release the traumatic experience that I had, and it was very, very effective. And I direct my patients to get that particular therapy, and they've had very good success with it too. So I just wanted to reinforce what you were saying.
And the nice thing about EMDR, it can be done in a session. Sometimes it will take more than one session, but it's so fast and so effective. And a German psychiatrist by the name of Dr. Bessel van der Kolk, he has written a book called The Body Keeps Score. And it's all about holding that trauma in the body. And one of the things that he highly recommends is hypnotherapy, hypnosis, and EMDR. And he said, you know, it's crazy how a therapist can wave the fingers back and forth and you follow those fingers with your eyes and hold your head still. And he said, but it works. And he's absolutely right. It's that effective. So if you are still suffering from the hypervigilance, the anxiety, the depression, the grief, it was an enormous loss for so many. And you're still finding that you're having sleep disturbance and some of those symptoms that Brian mentioned as well.
Mhm.
You may want to look on Psychology Today and find a clinician near you that is trained in EMDR. It would be well worth it.
Yeah,
So,
and for those of you that are local, we do have a therapist here at Fort Myers Acupuncture Massage that can do that. And of course, the massage therapy is very, very soothing. Acupuncture can really down-regulate that sympathetic nervous system, that fight or flight response.
mhm.
I have people, when I start working with them, they're very, very touchy, but we get them relaxed. We calm that nervous system down, and it's a totally different situation for them, a different experience for them once they've had the treatment.
I can vouch for that.
Yes.
Beautiful. So, one of the things that at least popped into my mind when you were sharing that last section is also the words that we're speaking out about it. And I'm asking this because I'm curious if it resonates from your experience of, wow, things are tough, and there's certainly a window of time of acknowledging, as you said, that grieving process of, wow, this is a really tough time, to shifting the words so that they're reinforcing things are getting better. When we're in conversations, does that, from a clinical standpoint, does that land? Does that matter? Shifting the words that are coming out of our mouths.
Absolutely. Well, our thoughts become things, and the power of words are so vital. Instead of saying I want or I will, how about saying I have or I am?
Mm.
As if what you want has already happened. I am abundant. I have a beautiful new home. Brian?
Well, we all tell ourselves stories.
Mm.
And sometimes people become identified with what they've been through, what their trauma is.
Mm.
And I've had patients that come in, and every time I see them, they tell me the story of what they went through.
Mm-hmm.
And then sometimes it becomes embellished over time. And I don't mean to detract from what they experienced and everything, but the story becomes an impediment. They're like you said, it gets locked in the body.
Mm-hmm.
And I find it for myself too, especially as patients, come back from up north or whatever that I haven't seen for a while, and they want to know what my experience was in the storm. And I find myself getting into the story of how traumatic it was, and we didn't know if we were going to live and all of that. But I try not to buy into that too much, and I try and tone it down and not, aggrandize or use hyperbole or whatever to embellish that story. And yet some people wear it like a badge. I like a purple heart that this is my wound that I've been through.
And I'm holding on to that.
Right, they're carrying it around with them. So I try and get people's languaging to change. Like, somebody may come in and say, oh, my life was ruined, my life was destroyed. And there's nothing good about saying those things, Obviously they're speaking to me, so their life wasn't destroyed. But again, there's the mind's tendency to, excuse me, to embellish and make things worse.
And our brains are hardwired to go to the negative. And it's easier to do the negative than the positive, but we have to be able to reframe the negative thoughts to positive thoughts. And that's where, as Brian was saying, I have a whole new perspective on moving forward. And I am taking each day, and I'm living more present. And that will help people feel a sense of we're moving on, we're able to move on. And this is a good feeling, as opposed to wearing that badge and staying in the past, if you will.
Right. And so if, go ahead.
Yeah, I'm actually experiencing what we're talking about.
Mhm.
If you notice, once I said, didn't know if we were gonna live or not, all of a sudden my throat closed up.
Mm,
And now I've got a little cough and everything. So, because and that is what I experienced at the time after the storm because of all the mold and everything.
mm,
My sinuses all closed up, my throat would close up.
Trigger.
So here, just talking about it, all of
mhm,
a sudden my sinuses came up, my throat came up, and
Perfect example.
perfect example of the residual emotional trauma coming up and affecting us physically.
mm.
It's all connected.
Right. Yeah, totally. I have so many stories coming into my own mind just from small moments that I'm noticing that those are triggers. And so in to you, Dr. Clancy, thinking about decision making, like we're in this space where people are experiencing this trauma consciously or subconsciously. What are some key steps that they can make decisions to get themselves to the next level away from the event?
I think at any given moment, people have to realize that they have a choice.
Mm,
I can choose to live back in this step, in this
mm,
moment when this all happened, or I can choose to make healthy decisions, healthy coping techniques, so that I can live more in the present moment and look forward to what's ahead.
mhm,
And I know every day, it's easier said than done, right? Every day, especially people who are having to continue to work on their homes or rebuild and having to deal with a lot of delays and a lot of frustration. But that only hinders the process. So even though that's happening, once again, I choose to believe this is where I want to be, this
mhm,
is where I want to live, this is home, and I'm going to choose to do whatever it takes to make it work and to get through it. And it's going to be day by day, moment by moment. And before you go to bed at night, take some deep breaths, close your eyes, and just lie or sit in the silence or put on a meditation app. I can't tell you how much that can help
mm,
and help you to also cultivate that present moment awareness instead of being, what am I going to do tomorrow? What if this doesn't happen? What if this doesn't show up? And then that's that monkey mind and that spinning again. And that's what we want to avoid. We want to
mm,
stay present in the moment. I have
mhm,
all the gifts I could possibly ever want or need.
mm,
I am abundant. I
mm.
am working toward getting everything exactly where I want it to be.
Right. Yeah, I'm hearing be decisive inside of giving yourself patience, and then if
Absolutely. Yeah.
one day isn't as great as the day before and movement forward, give
Mhm.
yourself the patience and continue the path the next day.
And just be patient with yourself and also give yourself permission when you do have those moments that come up because
Mm,
they will. We're humans and we're living the human condition, and just be patient with yourself and say, kind of had a bad day or bad moment. That's okay.
mm,
Honor and respect yourself and love yourself and give yourself that compassion that you need. You've been through a lot. You've been through trauma. You've been through grief and loss, and that does not heal overnight.
mhm, mhm. Right.
And to highlight something that Connie said about meditation or apps, there's a particular technique in yoga called yoga nidra or yogic sleep.
Mm,
I've been trained in that and I'm a practitioner. And what it does, it's in general terms, a guided meditation or a deep relaxation.
mhm,
But the wording is usually very specifically chosen and it helps you to move from the busy, beta wave mindset to an alpha, more relaxed mindset,
mm,
and then even lower to delta or theta, which are the brain waves that are associated with dreamless sleep. And then in the verbiage of the meditation, the guided meditation, there are affirmations and intentions that are spoken when we're in that deep state. In other words, we're listening to those intentions, or we're creating them for ourselves. And when we do that in that deep state of non-thinking, it impacts us very, very deeply. And it kind of reaches into our psyche, bypasses the frontal cortex and the comparative mind, and goes more into the limbic system, the deeper mind, to make those significant changes. And Yoga Nidra is very, very available. It's very accessible. There are lots of apps and YouTube videos and things like that. We will be starting a Monday evening Zoom Yoga Nidra. So again, it's a very available technique. Anybody can do it.
Beautiful, beautiful, beautiful.
And there's so much out there. If people just do some research and look for those tools, if they're running out of their own tools, to help them to be able to cope effectively on a day-to-day basis. There's a lot of wonderful information available.
Awesome. Well, and I was just going to share that, obviously both of you are such wealths of resource as well as information, experience, and all those things. And so, for anyone that's local to Southwest Florida here, obviously Dr. Healy has the local practice with the acupuncture, the massage, obviously some mental health resources. And then Dr. Clancy, I know that you are occasionally in Southwest Florida, and
yes.
and also, but you do travel and spend some time in Colorado. So I believe before we talked, you mentioned that people can connect with you virtually as well, to have you as
That's right.
Yes.
Right. And they can also find me on Psychology Today.
Okay. All right. Beautiful. Awesome. I mean, I'm really hopeful that anybody that is listening to this is just that gain some clarity, not to play a pun on words that we talked about, but that they can maybe recognize some more trauma-induced symptoms that they may not have been aware of, and have some steps to move forward, to start to continue, or I shouldn't say start, but to continue to clear whatever that is for them. Either of you have anything in closing that you'd like to share?
One thing at a time.
Moment by moment.
We start with one step and focus on that, whether you choose the EMDR or to talk to a counselor, or do Yoga Nidra, or go to a yoga class, or read a book. Just do that, and then move on to something else, and something else, and something else. Once you recognize that this isn't a topic that you want to address for yourself, don't think about, oh, I've got to do this. Start with one thing. Be successful at that, and then expand your resources and expand your techniques. Don't get overwhelmed.
It's very easy to get overwhelmed until you can come back to the present. And that will help you so much in terms of being able to be right here, right now, and not being out in the future, which is where our anxiety comes from.
Yes.
Or the past, where our trauma comes from.
And the rumination.
Yeah.
Right. Amazing. Well, thank you both for your time. And for anyone that's watching, below this video or on this page, wherever this is existing for you at the moment, there will be contact information for both Dr. Healy and also Dr. Clancy. And I encourage you to reach out. They are incredible resources, and all the other resources that they offered as well. So thank you both for your time.
And thank you, Cameron.
Thank you, Cameron.
Yeah. Thank you for your excellent questions, and thank you very much.
Yeah, absolutely. My pleasure. My pleasure.
Okay.